Unicam's considering ways to allow more workers, such as dental hygienists and physician assistants, to get a license to work in Nebraska and also other states.
Our 6 News' Johan Marin is on your side, breaking down how it could help relieve the state's healthcare worker shortage.
Nebraska state leaders reviewed interim studies on Wednesday to possibly be a part of 3 healthcare worker compacts. They're known as LR-233, LR-132, and LR-232, and were all presented by Senator Carol Blood.
LR-233 relates to the Interstate Compact for Physician Associates. LR-132 is the Interstate Compact for Dentists and Dental Hygienists. And LR-232 is the Interstate Compact for Social Workers.
The overall goal is to allow workers in these particular fields to get a license in states that are part of the Worker Compact. Blood believes this will help make job relocation easier and bring in more out-of-state healthcare workers to Nebraska.
Every state in the United States has a workforce shortage, and Nebraska is not the exception. Nebraska's healthcare industry is one that suffers the most from this shortage. This shortage means limited access to treatment, especially in our more rural areas and other underserved communities.
Mary Bainey, who is a part of the Nebraska Association of Social Workers, sees the barriers these work compacts could eliminate, especially in rural communities where the number of social workers is limited.
Currently, social workers must obtain a separate license in each state in which they wish to practice.
And not just social workers, but dentists and dental hygienists and physician assistants.
Compact will improve access to care for Nebraskans at a time when workforce shortages are definitely creating some gaps.
But most importantly, it will provide more opportunity for healthcare workers,
while increasing odds that they remain in the state.
The Department of Defense has partnered with the State Government Council to give money to fund the social worker and dental compacts. But so far, Senator Blood says there's not any funding for the Physician Assistance Compact. On your side in Omaha, Johan Marin, 6 News.
The next step for the state is to join these worker compacts, and that's going to be, of course, up to lawmakers. In January, when the legislative session begins, they will decide whether these interim studies become bills.